Hi, a very warm welcome on TFM and Pragatives. I'm with you, Madhvi, and today we are joined by Mr. Rahul Datta, Group CEO of Ankura Hospitals. A very warm welcome, sir.
Thank you so much, Ravi. Thank you.
So, today we talk about the maternity and the child care. What does an integrated model of it look like?
So when we talk about integrated model, it's very important to understand, Madhavi, that from where we start. So when we look at right from a pre-pregnancy journey, if we can, ease the care for the mother or the mother to be, from taking care of her comorbidities, taking care of her weight, taking care of her complications that may come up during delivery, which is very important. For that, what is required? For that, you need to provide a very, very strong infrastructure, a very, very strong presence of clinical, expertise, including fetal medicine, so that we have the right screening for the child and the mother as well, so that we can actually reduce the number of complications by the time the delivery comes. We can detect hypertension in mother. We can detect the complications of the child's growth. We can detect gestational diabetes. All of these contribute to the way the outcome of the health of the mother as well as the child is going to be. So that is something is very important to integrate. Followed by, since we have 25% of obstetric deliveries are high risk in our country, if we can ensure that post delivery, the critical care, if it is required, unfortunately for the baby, for the child, we have a very strong neonatal ICU care provided within the same infrastructure as well. And going, taking forward beyond deliveries as part of children's care, we have also, what we've done at Ankura Hospitals is that we've taken it in terms of pediatric care for the entire spectrum, from right from the birth till 18 years. We can provide general pediatric care, we can provide critical care for ICU patients, we can provide surgical care and entire super specialty for pediatrics. So it is basically a setup which is right from fertility to delivery to entire pediatric gamut till the entire 18 years of children. So it's a multi-specialty of children supported by entire mother and child care for fertility and delivery together.
So, with changing times, we are seeing that the requirements of the parents are changing right now. And earlier, the families were joint, and these days, there are much more nuclear families. So, are we technologically that much advanced to meet out the requirements of the current parenthood, current parents?
So, with the changing times, we have to focus on the experience of birthing as well, and that is where I think integrated care also comes into picture. So, we have been able to, take care of not just the clinical care, but also what it requires for a mother to remain healthy before and after delivery as well. And for that, it's important that we have childbirth education for the mother, and not just the mother, for the entire family, right? So and we bring in the emphasis of breastfeeding. These days maternal age is obviously increasing, right, for delivery. So it's very important to make sure that they are maintaining their lifestyle and health, so that these comorbidities can be also in check, which is hypertension, diabetes and others. If we are able to take care of all this, and we are able to make the patient experience where they can reach us, where this is where our digital transformation, our AI integration with services, so that you can, within a WhatsApp chatbot, you can book an appointment, you can get your reports, you can get your diagnostic reports, you can talk to a doctor. All of these things, we are trying to make it is possible. A lot of these are already live, and going forward we will have more in terms of clinical decision making, also in terms of making sure that patient can reach us at the tip of a finger, right? And that's what the demand is. They want to understand how the mother themselves can remain more healthy, right, before and after deliveries as well. Postpartum care, if we are able to provide all of that in an integrated under one roof, I think in all our 14 hospitals, Ankura has been able to do that for the past 14, 15 years.
These days, we see the concept of the single mothers and the single fathers is also evolving. And accordingly, like we were talking about the parental requirement. So, regarding that, the IVF facilities, the surrogacy facilities, do we have that much accessibility in India about them?
The awareness on requirements of fertility has been tremendous, I would say, in the last 5 to 10 years. Before that, it was very low. And with the changing in lifestyle, I think, and the maternal age, as I mentioned, conceiving has been a challenge in the last 5 10 years in India. And there has been a tremendous awareness and growth that has happened in India during that period itself. It is more obviously, if you see today, in all urban platforms, in all urban cities, in market, it is present there today. And slowly now it is moving to a tier 2 city as well. There are areas, there is still some time for the awareness to actually penetrate across rural population as well. But I'm sure over a period of time it will happen. But the need currently is seen because of the lifestyle, because of the maternal age, seen more at urban places. It is more there. But I'm sure in due course of time it is going to happen as well.
I see with increasing corporate pressures because people are working these days. So the mental health is also a factor right now. So how can we talk about and how can we consider the mental health of a mother who is a working mother? Because she is simultaneously handling the work pressure as well as handling her child. How do we treat it?
The first thing before treatment in this particular segment is to accept that there is, uh, you know, a concern. I wouldn't say it's a mental problem, but there is a concern in terms of the mother's psychology, postpartum effect, the way the lifestyle is becoming fast and rapid. So once that acceptance is there, it's very important that it is supported by the family first, right? We were just discussing also that many families don't realize that the newborn mother, herself has got postpartum depression or not is not realized by the family. So it starts from there. If that awareness is there, next level is the acceptance. If the acceptance is there, Madhavi, then they will come forward. We have the means and tools. We have, you know, clinical psychologist, we have psychiatrist in our facilities where we would be able to provide such kind of counseling for both the mother and even for the children as well. So here we see that it's a lot of counseling that is required right from the family, the immediate treating doctor who is the obstetrician, and also reaching out from the patient side to us within this. So first is initiation and then acceptance, then the care delivery could be provided. But of course, in terms of these issues, which is predominantly in the metro and the tier 1 cities, I think the availability is not a problem in today's time. We should be able to provide it, and in all our 14 hospital, which is also including a district level or a tier 1 city or tier 2 city as well, we are able to provide such cares.
What are the different sort of facilities that Ankura is offering right now that our viewers won't be getting anywhere? Because what I see is Ankura is working on various different projects in terms of serving the mankind. Is there something specific you want to tell our audience about?
I think when it comes to differentiation, we have right from the beginning itself, we have differentiated in terms of our specialization. We are very, very strong in neonatal critical care, right? We are very, very strong in developing pediatric specialty care where we are able to provide the treatment from newborns to 18, 17, 18 years old child till he becomes adult, be it pediatric specialties, like I mentioned, whether it is pediatric gastro, pediatric neuro, orthopedics, even pediatric hemato-oncology issues, pediatric ICU and surgical issues. So across all our centers, we are able to cater to 4 to 5 states right now. We are coming up in the new state, which is MP, and coming up in Indore next month. And we intend to extend ourselves in places like Northeast India, East India, as well as tomorrow we would love to come to NCR region as well. What are we going to offer here is going to make a difference is a comprehensive super specialty pediatric care backed by very, very strong digital transformation, technological adoption, and a very strong presence of fertility and obstetrics care with high risk and maternal critical care presence as well. A lot of centers would be there where it is not very easy to provide 24 hours critical care for the mother as well with anesthesia coverage. We are able to provide those as well. So I think these are the areas majorly we make a difference where care delivery becomes an advantage. Reaching out to patients reaching out to us becomes much more seamless, where we are already working upon, and overall patient experience we are trying to enhance by providing operational efficiency. So I think putting together clinical operations and patient care model, what is differentiating us.
Thank you so much for joining us today, and it's a pleasure.
Thank you so much, Madhu, for having me. Thank you.